So this is a short video abstract about the paper which is published in this edition, looking at therapists' views of manualised approaches to treatment. I'm Liz Forbat and the lead author on the paper. So we were curious about how it is that clinicians think about and use treatment manuals. We know that there's an increasing push towards manualised approaches because of government being very interested in approaches that can be replicated and that appear to have a strong evidence base. So increasingly there are more manuals being used. We know that anecdotally people aren't necessarily all that happy about using manuals, but that is anecdote. So we were curious about, well, if we look at the research literature, what is that going to tell us about therapists' views of using manuals that have actually used them? So we thought, what better way to do that than to conduct a systematic review? So that's what we did. We looked at 7 key databases that hold that kind of publication material. So, for example, but not limited to ASIA, CINAHL, Cochrane database, those kind of places. And we applied some predetermined search criteria to those databases and came up with a lot of hits, over 1,300 papers, which we reviewed to identify which of them were reporting therapist views of manualised interventions. So from that over 1,300 papers, we reduced down by our exclusion criteria to look just at those that were reporting therapist views who had actually used manuals. So we excluded some because the therapists perhaps hadn't used manuals, it was just a description of developing a manual, or perhaps patient views of manualised interventions. So we reduced that down to just 12 papers that actually reported what we were interested in looking at, which itself is an interesting thing that very few papers have been published on therapists' views of manuals. So then we conducted a narrative analysis, thematic narrative analysis of the papers to identify what were the key issues coming out in these. And we've broken that down into 3 sections. So one of them is about people's previous exposure to manuals. A second facet was looking at the therapist characteristics, and the third was about characteristics of the work. So if we take those each in turn, what we realise is that in terms of exposure to manuals, when people have had exposure, they're more likely to be positive about using them. So if somebody has a first exposure which is negative, they're more likely to continue having negative views about manuals. But it appears from these papers that we reviewed that actually if you have access and exposure to using manuals, then you're more likely to be quite positive about using them yourself and talking positively about using manuals. So we also felt that what was coming out of those papers looking at exposure to manuals was that people that had used manuals were also able to talk about how they were able to integrate their own style, their own approach to therapy within the context of the manual. So we know that one of the critiques of manualised therapies is that therapists might feel constrained or like they can't respond to the relationship developing between themselves and the client or clients. And actually people that had used manuals didn't feel like that those were constraining factors on the whole. So exposure to manuals is really important. It was very varied actually. So a couple of papers talked about the clinicians who had exposure to manuals. So one of the studies said that even people with doctorates in clinical psychology, some of those had never actually had exposure to manuals, and many of the respondents across these studies had said that they would be interested in more training on manuals. So that was the first element about exposure. The second element that we found in the findings was looking at therapist characteristics. So what we found here was there was some conflicting data about years of experience with being therapists, but quite clear data actually that younger therapists, so those aged 45 and under, were more positive about using manuals. So it's not necessarily about years practicing, but more about the actual chronological age of practitioners is what these small number of studies was reporting. It also suggested that in one US study where we had a cohort of therapists, that white male therapists were less likely to be positive about being flexible with manuals than African American female therapists who felt that actually they could adapt the manual to their own style. Thirdly, the kind of work. So no surprise really that psychodynamic psychotherapists in particular and interpersonal therapists felt that it was much less meaningful to their work than people trained in cognitive behavioural therapy. So that was kind of the core of the findings that we found across these papers, reduced from over 1,300 down to 12. So what does that all mean? Well, it means that there needs to be more exposure to manuals in training. If we're expecting clinicians increasingly to be caught up in producing evidence and working with evidence-based practice for government, then we need to be exposing people to manuals earlier on, and particularly in their trainings. So perhaps more of that. One of the other findings was that actually clinicians that had involvement in developing manuals were more positive. So perhaps we need to do some more work breaking down the barriers between academia and clinicians. I guess the final summary is something that my mum's been saying to me for as long as I can remember, which is that maybe you don't know if you like something or not until you've used it, and that's very much what this systematic review told us about therapists' use of manuals.